Welcome to My Life on a GLP-1. I'm Scott Johnson, and I'm here with my co-host Sarah. And today we have a special guest joining us in just a little bit, and I cannot wait to introduce him.
Hi everyone, today we have Andrew joining us and he's got some amazing information to share with all of us. But before we do, Scott, tell us your story of your recent colonoscopy. And what does this have to do with taking a GLP-1 medication? I assume you went into this procedure feeling pretty confident about your prep, right?
Oh, absolutely. I had followed every single instruction to the letter. I was so proud of myself. I'd done the full prep, fasted for the required time. I even brought my medication list like they asked.
Right, I'm sure you were the model patient.
So I thought. So I'm there, ready to go, and the anesthesiologist starts going through my medications. When she gets to my Zepbound, she stops and asks, "Are you currently taking any GLP-1 medications?" And I said, "Yes, I take Zepbound. Why?"
That why sounds ominous.
That's when everything changed. Suddenly, there's this flurry of activity. People are talking about gastric emptying and aspiration risks, and I'm just lying there thinking, what do you mean it changes things? I followed all the rules. I have been a perfect patient. What did I do wrong? Am I going to die? Is this going to be on my permanent record?
Oh wow, that internal panic is so relatable.
So let me pause and introduce you all to Dr. Andrew Albert, who is the medical staff president at Advocate Illinois Masonic Medical Center in Chicago. Andrew is an executive physician with 20 years of strategic leadership and medical oversight as a medical staff executive, medical director, chief of gastroenterology, and leader in population health initiatives. Hi, Andrew, and welcome to the podcast.
Excited to be here. Thanks for having me. This is a subject I'm very passionate about and so glad you asked me to join you all.
Andrew, I'm curious if you have any idea of what they told me in that moment.
I have a pretty good idea, but we'll get to that. You see, it turns out these medications slow down gastric emptying significantly. We're talking food potentially staying in your stomach for 24 hours or more, even after following standard fasting guidelines.
Wow, 24 hours. That's way longer than normal. And this applies to all GLP-1 medications, not just Mounjaro.
Right. And during anesthesia, if there's still food in your stomach, there's a risk of aspiration. Basically, stomach contents coming up and potentially going into your lungs. It's a serious safety issue. The effects can vary slightly between different medications and dosages, but the anesthesia concern is universal across all GLP-1s.
That sounds scary. So then I guess they canceled my colonoscopy that day.
They had to reschedule. Many surgical protocols now recommend temporarily holding GLP-1 medications before elective procedures. The specific timing depends on the medication's half-life, which is how long it remains active in your body.
So how long do you have to temporarily pause or even hold?
With the weekly injectables, some protocols recommend holding for 1 to 2 weeks before major procedures.
In addition to the pause, what is the single most important thing someone on a GLP-1 should know before a procedure such as a colonoscopy?
Communication is essential. Even if it's documented in your chart, repeat it. Electronic records don't always communicate across departments, and anesthesia decisions depend on this information. Please don't assume anyone knows, even if you have talked about it with one team member. Medical records do not always communicate perfectly between departments. Each provider needs to hear directly from you about this medication.
That is really important for us all to know, Andrew. There is so much stigma about these medications, and I know many folks might not know how to have these conversations.
Scott, that is a great point. Here is a script that you can all pause and write down to use. Grab your pencils. I want to make sure we are planning appropriately for my anesthesia. Currently, I am taking X medication at X dose and X frequency. I understand that GLP-1 medications can affect gastric emptying and potentially impact anesthesia safety. Can you tell me what precautions I should take, including whether I need to pause my medication before surgery and for how long?
That's brilliant, being proactive about it. What about emergency surgery, though?
Emergency surgery is still absolutely possible. We just take extra precautions like using different anesthesia techniques or inserting breathing tubes.
Wow, Andrew, that's really helpful to know. I'm curious, Scott, how was that week off the medication? Did you notice any changes in your appetite or other effects?
Oh, absolutely. Remember, I had fasted and done my prep. I could definitely feel the difference. My appetite came back with a vengeance, and I had to be really mindful about portion control. The food noise returned, you know, that constant thinking about food that the medication had quieted. It was a good reminder of just how effective these medications are.
That food noise coming back is something so many of our listeners relate to. It really shows how significant these medications' effects are on our relationship with food.
Bottom line, it's manageable, just requires different planning.
So, Scott, I want to know, how did the rescheduled colonoscopy go?
Perfect. Once I'd been off the Zepbound for a week, everything went smoothly. No complications, and honestly, I felt much more confident knowing everyone was properly informed.
So, Andrew, what's your biggest takeaway for other GLP-1 patients facing procedures?
Don't assume your medical team knows about GLP-1 effects on anesthesia. Speak up early and often. Ask specifically about timing for pausing your medication, and don't panic if they need to reschedule. It's about keeping you safe.
Andrew, thank you so much for sharing your story. This is exactly the kind of real world experience that helps our community stay informed and safe.
Absolutely. And remember, everyone, always champion for yourself and communicate openly with your healthcare providers. And if you are in the mood to be a great advocate, I hope you will take a moment to share this podcast, leave a comment, or give us a 5-star rating on whatever platform you stream on. Scott will be sure to post some additional resources about GLP-1 medications and medical procedures on his website at mylifeonglp1.com. Do either of you have any final thoughts we can share with our listeners today? Andrew, I'll start with you.
First, let me say thank you for inviting me to join. This has been fun, and thank you for all of the advocacy you do to help others on these medications. Let me end with the fact that medical societies, including the American Society of Anesthesiologists, are actively working on standardized guidelines for managing patients on GLP-1 medications during surgery. As research continues and more data accumulates, protocols will likely become more refined and specific.
Thank you again, Andrew. Let me say, your patients are so lucky to have you, and I am lucky to call you a friend. If you have surgery scheduled and you are taking GLP-1 medications, take a deep breath. You now know what questions to ask and what to expect. You have the tools to be an active, informed participant in your surgical safety planning. And unlike my colonoscopy surprise, you will walk into that appointment already knowing that yes, being on a GLP-1 medication does change things. But with good communication and appropriate planning, it changes them in manageable, safe ways. Besides, who doesn't just love going through the colonoscopy prep a second time? Thanks for joining us today. On behalf of Sarah and our very special guest, Dr. Andrew Albert, I'm Scott Johnson, reminding you that you are prepared. Your team is prepared. And everything is going to be okay. Love your journey.